Hello friends, I hope you're all doing great. In today's episode of the Dialysis Diaries series, I shall talk about the time when my chronic kidney problem was detected, about the treatments, the various symptoms, and of course the initial struggle that I had to go through. Of course, there would be a lot of time in this video when the details would be a little sad and disheartening, but again, that's reality, so you have been informed. Also, because I would be sharing a lot of details through this video about my kidney problems and the various things associated with the treatments and definitely the associated factors. So there shall be definitely a lot of key takeaways for you all, since everyone is prone to having kidney disease these days, and that too at any age. And trust me, I have spoken with a lot of doctors, nephrologists, because I had so many questions, particularly in the starting days, even now. And most of the doctors had said the same thing, that chronic kidney disease is a silent killer. You hardly get a lot of symptoms when your kidneys are deteriorating. Kidneys work in a very silent manner, they hardly complain. Of course, if you are too observant about what's happening in your body, you might feel that there are certain symptoms, not very prominent ones, but we tend to ignore them because they really don't stop our day-to-day activities or our work life. Certain things like having a headache or having a back pain, or your fluctuating blood pressure levels, they don't make you take a sick day, or it's like a stopping factor for your day. And we think that okay, this may be due to the stress and tension of regular work life, due to the regular humdrum of everyday living, and we tend to think that okay, these are minor things and that would not have a big impact, so fine, we can take a cup of tea and our headache will go, we can go for a little massage and our back pain will heal. So we tend to think in that way. But in my case, that had been actually the indicators, which even I thought are just the minor ones because of the daily work stress, long hours of work, and nothing really very serious. Let's go back to the month of November, the year 2020. So it was lockdown, I was working from home, and in the morning I started working on my laptop, and suddenly I felt that I am having some problems looking at the document in the laptop. I was working on some documents. I was not able to see clearly, especially in the right eye. I thought that maybe it's a minor infection, so I looked at the mirror. So I was having problems with the vision, and it was becoming increasingly difficult to focus at work. So I decided to pay a visit to the eye doctor. So as planned, I went to the doctor in the morning, and he gave me certain drops to clear the eyes, so the regular ones. And then he did a detailed test with his eye testing machines. And after the test, it took around an hour, I was there in the doctor's chamber. And then he asked me to sit down, and then he started talking about the observations. What he mentioned really surprised me. He said that I need to go for a full body checkup and do a list of tests that he would prescribe. What are those tests? Those were an ECG, lipid profile, kidney function test, blood hemogram tests, and it was a big list. I was totally shocked and was in awe. I asked him that there is a problem in my right eye, and somehow I think it's an infection maybe, but why do I need to go through all this set of tests? How does it even matter? How is it related to my eye? What he said again surprised me. He mentioned that leave the eye for now. I think there's definitely some problems which are bigger ones happening inside your body, and you need to focus on that first. In the meanwhile, I'll give you few eye drops, but they are mostly to just keep it clean. But only when I see the reports can I talk about further eye treatment. So right now, go back and get the tests done as soon as possible. Well, I went out. On my way back home, I was talking with my wife, and I kept wondering, why do I need to do an ECG? Why do I need to do blood pressure tests? Why do I need to do blood tests, hemograms? Why all this when I haven't taken a sick leave in the last 1 year? I have never been bedridden. I have never fallen sick. I am doing my day-to-day work regularly. I am managing my projects fine. I am collaborating with a lot of people. I am managing my family. Then why does the doctor think that all these tests have to be done? That was really a time when everything was in confusion. I was in confusion. You really, don't get to do all these tests all of a sudden when you are actually thinking you are healthy, fit and fine. So it was during the time when the lockdown was in full implementation, and there were not a lot of diagnostic centers that were open. But somehow I managed to get my tests done at home. So the technician came in the evening hours and did an ECG. So you get that printout after the ECG, and then he had a look at it, and his face was dark and he was serious. I said that, why are you serious? Is the ECG all fine? He said that, no, that's something that the doctor will tell you. I am just a technician. I said, well, but even technicians have a lot of experience, at least in looking at the chart and see whether things are normal or abnormal. And after a serious look, what he told me that my opinion, something is way off the mark. Something is definitely not normal, and the first thing tomorrow morning you do is consult a doctor. So the next morning I went for the local doctor, because during the lockdown, even it was very difficult to get appointment of doctors in big hospitals, and somehow I got an appointment with the local doctor, and I showed him the ECG report and then told him about my visit to the eye doctor and what he said. He also mentioned the same thing, that once only I get to see the reports that your eye doctor had suggested, only I can tell you more about the next course of action. So till then, you just start having. So till then, here are few blood pressure medicines which I am writing in the prescription, and you start taking them because your pressure is really very high. So at that time, it was in the range of 160, 100. You know that the normal range is 120 by 80. So by that time, I already had started looking for appointment in our nearby Narayana hospital, and I took the appointment of a cardiologist because the ECG was abnormal, and again there was problem with high blood pressure. So the obvious thought was that I should look for a cardiologist, that it might be a problem with the heart. I started taking the blood pressure medicines as suggested by the doctor, and the reports were awaited in the next 7 days. In the meanwhile, I started feeling increasingly uneasy after each passing day. What were the symptoms? I was having a lot of nausea, as in confusions in the head. I was having severe back pain, particularly in the waist area. I was also having little problems while breathing. So as in I had to give a lot of effort to do the normal breathing. And another one was I was vomiting. As in, even if I would take soup and bread, I would vomit it. And I would vomit for 4 to 5 times a day. I could not even still think of what's going on. Maybe is it indigestion, maybe it's food poisoning, or maybe it's something, I really don't know. Why would I have problems breathing? So one fine day I went to the local market. The regular grocery I had to buy. Just a few simple things. And when I was coming back home, all of a sudden I started breathing heavily, and I could literally hear the sound of breathing, as in I really had to take a lot of effort just to do the normal regular breathing. And in the midway, I had to sit somewhere just to be little stable. I was becoming increasingly unstable, as in it was totally discomfort. I was feeling very exhausted, although it was just the morning, and it all started. While it all was happening, never in my wildest imagination I could think that something had to do with the kidneys. I all of us, I only thought that the kidneys function is to just filter the blood, take the toxins out, generate the red blood cells, managing hemoglobin levels. That's it. How can a kidney at all be related with breathing problems? That's something that the heart is responsible for. So that was a terrible day. I clearly remember I vomited at least 5 to 6 times that day. So every time I am having any food, I was throwing up. My face was all red and black, and my eyes were all red. I was feeling so stressed out. I really didn't know what's happening all of a sudden. Even 2 weeks back, I was going for 3 to 4 kilometers walk. I used to go for regular morning walks. But what all of a sudden happened in the last 7 days? And that too, I am having regular food, homemade food, because it's lockdown. So while this was happening, I finally got the reports, and I could not really make out much of it because there were a lot of medical jargons, and I really couldn't understand most of them. Finally, I could get an appointment to a top cardiologist in the Narayana hospital, and after some waiting, I went there. So he gave a serious glaze at the reports, and then he asked me, the questions were like, are you having pain in the stomach area? Are you vomiting? Do you feel tired all the time? Do you feel pain in the heart area? I gave the answers. And after around 10-15 minutes, he gave me the shock of my life. He said that you need to go to the nephrologist today. And I said, why nephrologist? Because I see that there's a problem in the ECG, so there should be some problem in the way the heart is working. I am having problems breathing. I think that's what the heart is responsible. But he said that you don't have to worry about your heart right now. So before you leave the hospital today, you must go to the nephrology department and get an appointment with the doctor I am referring right now. It is urgent and you immediately should go and talk with him. And whatever information he gives you, whatever consultation he gives you, after that you can come back to me and then we can talk, but not before your visit with the nephrologist. That was a turning moment. Now even the doctor is saying that there's something going on which is really serious, and perhaps the kidneys are associated with it. That time in the hospital, while I was waiting for my turn to visit the nephrologist, it was a very, very tense moment. I was so confused, I was so exhausted. I couldn't even think of anything because all the logical explanation were not working. My wife was equally tensed, she was equally confused. She even couldn't think of the things that are happening all of a sudden. I mean, it's just the last 7 days and I have never fallen that sick before. So finally the wait was over and I got to see the nephrologist, and he happens to be the HOD in the nephrology department in Narayana Hospital. And then he said something again, and that was, so in the interest of time, I believe that the video had already become long and lengthy. Would you like to know what happened next? If yes, let me know. I would put the details in my next video for sure. Thank you so much for your time and thanks for watching. We will meet again.